Hi everyone, welcome to my channel. In this video, I'm going to explain how to read a thyroid test report easily at home. Before that, if you have not subscribed our channel, please do subscribe and press the bell icon for regular updates and notifications. Before that, I'm going to explain a little about the thyroid gland. Basically, thyroid is an endocrine gland. It is situated in the mid of the neck, and the thyroid gland releases two hormones: T4 tetraiodothyroxine, T3 triiodothyroxine. These T4 and T3 levels are regulated or controlled by the TSH, that is thyroid stimulating hormone. This thyroid stimulating hormone is released by anterior pituitary gland, which is located in the brain. So, in brief, whenever the T3 and T4 levels are reduced, it sends a signal to the brain. The brain, that is the anterior pituitary gland, which is present in the brain, in turn releases TSH hormone, that is the thyroid stimulating hormone. This thyroid stimulating hormone helps to raise the T3 T4 levels. That is, whenever the T3 T4 levels are reduced, the TSH levels are increased. With this basic information, we'll go with the how to read a thyroid test report. So, any test report we'll get from the lab. We basically see three main keywords, that is T3 triiodothyroxine, T4 tetraiodothyroxine, and TSH thyroid stimulating hormone. In the screen you can see that here the T3 triiodothyroxine levels are 76.4 nanograms per deciliter. Means the particular person who underwent test has T3 levels as 76.4 nanograms per deciliter. Beside that, you can see the biological reference values. It is nothing but it is the normal values of T3. We can see, like in adults, the normal T3 levels are in adults of 20 to 50 years, the normal T3 values are 70 to 204 nanograms per deciliter. And in people with 50 to 90 years, the T3 levels are 40 to 181. And in pregnancy, the first trimester, that is the first 3 months of pregnancy, T3 levels are 81 to 190. In the second trimester, it ranges from 100 to 260. And in the third trimester, T3 levels are 100 to 260. And in children, 1 to 5 years old children, the T3 levels are 100 to 260 nanograms per deciliter. 5 to 10 years children, T3 levels are 90 to 240 milligrams per deciliter. And with children with the age group of 10 to 20 years, the T3 levels are 80 to 210 nanograms per deciliter. This is total about the T3 levels and their normal values according to the age group. Now we'll go with the T4 levels, that is tetraiodothyroxine levels. In this report, we can see like T4 levels are 9.9 micrograms per deciliter. And beside this, we can see the reference values. In adults, it ranges from 3.2 to 12.6. And children of 1 to 12 months old babies, T4 levels are 6.1 to 14.9. And 1 to 3 years children, T4 levels ranges from 6.8 to 13.5. And 3 to 10 years old children, T4 levels are 5.5 to 12.8. This is all about the T4 levels, their normal values in different age groups. Now we'll go with the thyroid stimulating hormone, that is the TSH. In this report, we can see that TSH levels are 2.42 micro international units per ml. And in the reference values we can see that TSH levels of different age groups. In children are in between 21 weeks to 20 years of age group, TSH levels are 0.7 to 6.4, and between 21 years to 54 years, TSH levels are 0.04 to 4.2, and in age group between 55 to 87 years, TSH levels are 0.5 to 8.9 micro international units per ml. Now we'll go with the pregnancy TSH levels. In the first trimester of pregnancy, TSH levels are 0.3 to 4.5, and in the second trimester, the TSH levels are 0.5 to 4.6, and in the third trimester, the levels are 0.8 to 5.2 micro international units per ml. Pregnancy trimesters is nothing but it is the gestational period, we can say in layman terms. That is the first 3 months, it is the first trimester. The 3 months to 6 months is the second trimester. 6 to 9 months is the third trimester. We call it as pregnancy trimesters. Okay. Now we here complete with this report, we can say that all the T3, T4, TSH levels are normal. Whenever these T3, T4 levels are normal, we can say that thyroid report thyroid normalcy or condition like euthyroid. I also explain certain cases with certain examples. For example, in case 1, we can see that in case 1, T3, T4 levels are reduced and thyroid stimulating hormone, that is TSH levels, are increased. So whenever the T3, T4 levels are reduced and TSH levels are increased, we call it as a primary hypothyroidism. This is a common case we can see in mostly. And in primary hypothyroidism, doctors advise medications, and depending upon the weight, the doctors advise the dosage. And coming to the case 2, here we can see like in the case 2, T3, T4 levels are reduced, but TSH levels are normal. So we can say that whenever the T3, T4 levels are reduced, TSH should be increased. But here in this condition, TSH levels are normal. So we can assume that there is problem in the pituitary gland in the brain. So we categorized this condition as secondary hypothyroidism. And in these cases, doctors refer them to the endocrinologist opinion in conditions with secondary hypothyroidism. Next, the case 3. In the case 3, in certain conditions where T3, T4 levels are normal and TSH levels are increased, so we categorize this condition as subclinical hypothyroidism. In these conditions, doctor observation is needed, and most probably there is no need of medication. Lifestyle changes and exercise, diet, all of them plays an important role to get the normal thyroid levels. In the case 4, we can see that the T4 levels are increased, T3, T4 levels are increased, but TSH levels are reduced. So we can say that it is a primary hyperthyroidism. In these conditions, doctors will advise certain medications to control this hyperthyroidism. And in the case 5, we can say that T3, T4 levels are normal, but TSH levels are reduced. We categorize as subclinical hyperthyroidism. In subclinical hyperthyroidism, basically observation is needed, and depending upon the regular follow-ups, doctors will think and they follow up, and required treatment is needed. Thank you. This is all about the thyroid test report, how to read the thyroid test report. Hope this video helped you. If you like the video, please share and subscribe. Thank you.